Welcome to the University of Cincinnati Internal Medicine Residency Patient-Centered Rounds tutorial entitled, Presenting the Patient History at the Bedside. After this presentation, medical teams should be able to engage patients and other team members in bedside presentations, determine what information should be included in bedside rounding, and be flexible with bedside rounds and not simply recreate traditional table rounds at the bedside. In this first vignette, see if you can identify the problems as well as the opportunities for improvement.
Hi, Mr. Chen. We're going to talk a little bit about your medical case today, and I'm going to ask Dr. Orange to tell us about what brought you in and what we're going to do for you.
Okay, so this is Mr. Chen. He's a 31-year-old Chinese male who came in for epigastric pain. Basically, the pain started this morning. He was having horrible epigastric pain radiating to his back. It was about a 10 out of 10, sharp, had some nausea and a little bit of bloody emesis. No fevers or chills, no diarrhea, nothing made the pain better, and anytime he ate, it got worse. That's pretty much what's going on with him. Other past medical history, he's had pancreatitis, hypertension, PVD, COPD, and diabetes. Medications, he's on, I think, metformin. I'm not really sure what the dose is. Metoprolol, omeprazole. He takes Creon sometimes if he has it. Sometimes a daily aspirin. And he takes Percocet, but we're not really sure what the dose is. Allergies. He's allergic to penicillin, doesn't really know what happens to him. Family history has a mom with diabetes, a brother with some kind of liver problem. He's not really sure what it is. And that's pretty much it on his family history. He smokes a pack a day for 20 years, drinks about a 6-pack every day. It's been a little bit more recently. No other drugs. No, he's not sexually active. He doesn't have any significant travel history, but sometimes he goes to Florida to visit his family, but he hasn't done that in like a couple months. On review of systems, weight changes. Sometimes he goes up and down, like 5 to 7 pounds. Like I said, no fevers. He doesn't have any itching, but sometimes he gets a rash on his lower shin. He doesn't have that right now, though. No trouble breathing, really. No chest pain. The belly stuff we already talked about. He hasn't had any melena or hematochezia. No anxiety or depression. Doesn't really get dizzy that much. No seizures, although sometimes he says he has a shaking in his left hand, but I'm not really sure what that is. And that's pretty much it that he talked about.
There are many opportunities for improvement in this case. Bedside rounds should not be a recreation of traditional table rounds. Bedside rounds should be flexible, engaging, and include only pertinent information. This means that not all information that could be included should be. Attending physicians can streamline bedside rounding by reviewing the resident's history and physical before rounds. Bedside presentation should focus on confirming the history by engaging the patient, setting up the encounter for shared decision-making, and assessing how well the learners engage the patients in care. In the next vignette, pay special attention to the way the team engages the patient and other team members in the bedside presentation, determines what information should be included in bedside rounding, and does not recreate traditional table rounds at the bedside.
Hi, Mr. Chen. This is the red team, and we're going to hear a little bit about your history this morning. Dr. Orange is going to fill us in about what brought you in. We'd like you to be part of this, so if there's anything that's not quite right, please join us and correct us. And then, Dr. Orange, I've read your H&P last evening, and I looked over all of the data that you supplied. Thank you for doing that. So can you please tell us a little bit about Mr. Chen and make sure that we got it right?
Sure. So Mr. Chen, we met last night. Nice to see you again. Like you said, I'm going to fill in everyone, and please correct me if I'm wrong. So you have a history of high blood pressure, also have diabetes, and you've had problems with your pancreas in the past.
Yeah, I have.
Right.
Yeah.
Okay, and today you're coming in with belly pain. It's kind of located right in the center, but a little up to the top. On the pain scale, it's a 10 out of 10, so some of the most severe pain you've ever had.
Oh, yeah.
Yeah, and it kind of shoots straight through the back, and so you feel it in your back. You've also been having some nausea and vomiting. Actually, you told me yesterday you threw up a little bit of blood after you've been vomiting for a while.
Yeah, but I only did it once.
Right. And then, since then, you've vomited and there's been no blood in the vomit.
Yeah.
Okay. And then you told me that nothing that you're really doing is making it better, but anytime you try to eat or drink anything, it makes the pain a lot worse. Is there anything I left out that you wanted to talk about?
No, nothing. Except that this is kind of like what happened the last time I had the pancreatitis.
And the other kind of important thing you told me is that you're not having any fevers, you haven't passed out or felt dizzy.
Mm-hmm.
Right. Okay.
Can I ask you one more question? Have you had any surgeries on your abdomen, your belly there?
No, I've never had anything like my appendix or something like that.
Okay. Good.
One medication I wanted to point out, we've been through your list. One medication I wanted to point out is that you're on Creon, the medication you take for your pancreas, and you've been out of that for the past couple days.
Yeah, it's probably more like 2 weeks.
Oh, okay. So I haven't had it for 2 weeks.
Yeah, been bad about that.
So do you think that being on a Creon would cause a person to have pain like Mr. Chen's having?
So, the Creon would be giving him his pancreatic enzymes, or what your pancreas produces, giving you that back. It wouldn't be preventing him from having pancreatitis.
Have you ever run out of your pancreas medicine before?
Not really. This is like the first time.
First time, so you don't know. I agree with her that that's probably not the cause of your pain.
Okay.
Usually when you stop and people get diarrhea, did that happen to you?
Yeah.
All right. Okay. Well, let's go on.
Okay. So
When conducting bedside interprofessional rounds, successful teams engage patients and other team members in bedside presentations, determine what information should be included in bedside rounding, and are flexible in constructing bedside rounds, and do not recreate traditional table rounds at the bedside. We hope you have learned something from our presentation on presenting the patient history at the bedside. Please visit our other video tutorials using the search word UCINTMED.